Medical fraternity, friends, guests, and Asterians. It gives me great pleasure to be standing here today in front of all of you, representing Aster's India growth journey. From a single clinic in Dubai in 1987, Dr. Azad Nupin, our beloved chairman, has built this organization into a global healthcare conglomerate.
So what we decided is we will go to where the patient is, and we decided that we'll come up with a mobile screening van which will be used to go to every Gram Panchayat, every small village in every taluk.
Took me and my colleague Sri M.D. Ranganath through their technology laboratories, showing how they are using technology for the benefit of neurological patients. I also learned something, and that is an intelligent man knows what to say and when, that a very successful expert who had all that he wanted in the United States to decide to come back to our country and a chance to take up neurosurgery. Therefore, whenever I meet people like these wonderful doctors on the dais, my energy, my enthusiasm, and my confidence in the country goes up, because there's so many reasons why you could be frustrated. I don't want to go into those details, but very easy to get frustrated. But what brings back that energy, that enthusiasm, and that confidence is meeting such people. To do today is a big success, because as we saw that wonderful video, they have brought smile onto the face of children, onto the faces of patients, and as importantly, onto the face of their parents, their siblings, and their guardians.
Thank you. It's an incredibly proud day for us. We have launched the Aster International Institute of Neurosciences and Spine Care. Besides that, what we are most proud of, perhaps, is our collaboration with Rotary International to launch the EPIC program, the Epilepsy Prevention and Integrated Care Program. Aster's mission has always been the marriage of excellence with service. And today, with the inauguration of our neurosciences department and the launch of the EPIC program, this is a great marriage in our mission of serving the community and providing accessible, affordable, and quality healthcare to all. We're very proud, we're very excited to see where the EPIC program can go. We have big aspirations for it. We really want to help this underserved community. Epilepsy is a stigmatized disease, unfortunately. A lot of people suffer in silence, families suffer in silence. It is our onus and responsibility to help these people, give them a voice and give them a solution. Very excited about this project. Aster is growing tremendously in India, and we want to take up more and more initiatives of this sort, which will really help the community. Thank you.
It's a very proud day today. We have joined Aster about 8 months ago, and we have completed about 700 surgeries. As you have seen today, all the equipment that we have at Aster Whitefield is on display in the corridor outside. It is a state-of-the-art. Some of the equipment is the first in Asia, first in Southeast Asia, and we are very proud to offer these equipments to our patients at a very, very affordable cost. So, in reality, we have brought the Western level of healthcare to the benefit of people in Bangalore, in the state, as well as the country. And we hope we extend these facilities to our neighbors as well, neighboring states, and also in Africa and the other parts of the continent.
Today, on a Onam Day, an auspicious day in the world, at the Aster Whitefield, in association with the Supriya and NGO, and the Rotary International and Rotary IT Corridor, we are starting a new program called as EPIC program. So, the EPIC program is nothing but epilepsy prevention and integrated care program. In this program, we are doing a public awareness program on epilepsy because epilepsy is a stigmatized one. Many epilepsy patients do not tell what exactly they have. So especially in the rural area, it has become a taboo so that, people do not come out, they don't go to school, they don't marry, they have a difficulty in communicating with the doctors, and families sometimes abandon them. To increase this awareness, we have come out with this epilepsy program. And those patients whose epilepsy is not controlled, that means, they get more than 2 to 3 episodes per week. We have a program where we do free MRI, free video EEG, and diagnose where it is coming from the brain. And there is a brain surgery available as of today, where if you find out the focus from where epilepsy is starting, we can take out that part of the brain and patient do as good as normal person. And many of them can come out of the medication. And this is done free of cost to all the below poverty line patients in Aster Whitefield Department of Neurosciences at in Whitefield. Please avail this. There is an app available called as EPIC-Rotary, which is available both in Kannada and English. And we have a hotline number. Please visit our website, Aster Whitefield Hospital, and you will find the helpline number. Any epileptic anywhere in the country need our help, we are always available to you. And this is a great program for society. Please do not differentiate epilepsy patients. They are as normal as anybody, and any one of us can get epilepsy, whether children, adult, depending on the age, or anybody who has a good brain. It is just an electrical activity which happens momentarily and spreads to the rest of the brain. It is not a disease, it is a kind of a symptom. If it is diagnosed early, 90% of the patients can be cured. And those who have a difficulty, please come to us. We are always there to help you and to tell you how to get treated, how to avoid it, and if you still have it, how I can make sure with a brain surgery and epilepsy surgery, we can make you much more better.
Thank you.
Thank you.